They're referring to performing a surgical or diagnostic procedure. It may be a different scenario than administering propofol for an off-label use.
Is it your testimony that if you're administering propofol for an off-label use, you should use less safety precautions than if you're using it for an appropriate use?
I didn't say that.
Okay,
no.
Then let me ask you again. I'm asking your opinion, Dr. White. Do you feel that these requirements and these concerns for the patient's safety involving monitoring, resuscitation, and all the available equipment, do you believe these should apply equally in a scenario where propofol was administered in a bedroom? Yes or no?
I think that many of the requirements would be appropriate, but I'm not sure all. I don't know why you would need a well-maintained anesthesia machine, for example.
So you dispute number two?
I don't know. I mean, I've just been confronted with this now, so you're asking me.
Well, this is your article, Dr.
Well,
White.
of course, but I published many articles, many book chapters. Having a trained nursing personnel and provisions for discharge instructions, I don't think would apply.
Well, let's just go one by one. Do you think if you're administering propofol in a bedroom, in a private residence, that there should be appropriately trained and credentialed anesthesia personnel? Yes or no?
It doesn't set forth parameters of what's trying to be accomplished.
Overruled.
I think there are healthcare providers who are certified to provide conscious sedation that wouldn't be considered anesthesia personnel. So I think that number one probably wouldn't apply.
So
Could be a non-anesthesiologist is what I'm saying, if they're properly credentialed.
So based on these guidelines, if you're doing it in an office-based setting, there would be a higher standard of care required than if you're doing it in a bedroom in someone's private residence. Is that what you're saying?
I didn't say a higher. I just said there might be different factors that would come into play.
Well, would those factors...
I didn't say a higher or lower, sorry.
Are you disputing the need for appropriately trained and credentialed anesthesia personnel if you're administering an agent such as propofol in a bedroom? Are you disputing that as a proper requirement?
I'm not disputing it. I'm just saying that this section of my chapter that you're referring to refers to office-based anesthesia.
And I'm referring to a bedroom in a private residence because that's what this case involves. So I'm asking you if you think that same standard of care should apply in a bedroom in a private residence.
Well, I'm pointing out that some of the specifics that are referred to here are not appropriate to the analogy that you're asking me to comment on.
I'm talking about number one right now.
If you're asking...
Do you think if you're doing it in an office-based setting, you should have appropriately trained and credentialed anesthesia personnel, but if you do it in a bedroom in a private residence, that's not necessary?
That's not what I said.
Okay, then is number one a reasonable requirement for someone administering propofol in a bedroom? Yes or no?
I think if I may, people are non-anesthesiologists are credentialed to give IV or conscious sedation. I think that would be a minimal requirement. So they're not anesthesia personnel. I'm not trying to nitpick words, but I'm just trying to answer your question.
So how would you revise number one to apply it to a bedroom standard of care?
Well, I think there are, I guess the analogy would be patients that are on home care or hospice care get sedative medications from physicians, and they're not necessarily anesthesia personnel. Hopefully they're physicians who are trained in the safe administration of these drugs, namely conscious sedation. It'd be a complex rewording to accommodate use of these drugs in a home environment. But it would certainly be worded differently than in this statement, which is an office-based practice environment.
As you look at People's 235, would you at least agree that administering propofol in a home should entail at least the minimum safety requirements involved in administering propofol in an office-based setting?
Yes, I would.
Okay, thank you. This is a good time, Your Honor.
Okay, thank you. Ladies and gentlemen, we are going to take the noon break at this time. Of course, please remember and follow all the written and the verbal admonishments. We'll be in recess until 1:30, and we'll resume at that time. Thank you.